say about myself. Let's see. I started my career. Well, first of all, I attended Mississippi Valley State University and achieved my Bachelor of Science degree in chemistry and biology. After that, you can see better. After that, I taught school at Broad Street Middle School and High School for about 4 years and coached girls basketball. We won the state championship in 2003. I cannot forget to say that. In 2002, I got my master's in biology at Delta State. I decided that I still wanted to go in healthcare. So I let teaching go for a second, apparently, and attended Delta State University's Bachelor of Science in Nursing program, getting my bachelor's in 2005, master's in 2009, and my doctorate in 2014. I started as a nurse at Destiny Hospice, being the clinical manager and eventually the DON there until I went back to school for my master's. Got a job with Dr. Kenneth Kello in North Delta Medicine Clinic from 2009 to 2011. Some of the best times of my career. I learned so much. Well, he ended up having to restructure his place, and I ended up in Shaw, Mississippi. Started my own clinic with the help of Miss Willa B. Taylor. She saw it in me, and I didn't see it in myself. She and one of my colleagues said, "Nora, you should start a clinic in Shaw." They had one there for all those years, and it closed. So nonetheless, I opened up Shaw Family Medical in 2012, and we're still going. We have our ups and downs, but we're still here. I think that's enough about me.
Did you also have clinics in schools, correct?
Oh, I forgot about that. All right, so anyway, we started doing the school physicals for their sports physicals back in 2000, let me think, 2013. Well, I was just going to the schools, getting their physicals done, really kind of taking up my dad's slack when he was doing them himself. And so when I started doing those, Medicaid came out with a rule that you couldn't do those unless you had a school clinic. That's real. I didn't have any intentions of having a school clinic. When Medicaid came out with that rule, I said, well, it looks like I got to comply. So we started our first school-based clinic in Shaw, Mississippi. At that time, it was Shaw High School. We ended up expanding in 2017. 2017, we started school-based clinics in North Bolivar School District. And I collaborated with a dentist, which is Dr. LaMonica Davis Taylor from Smiles on Broadway. I collaborated with Dr. Shaka Norwood from Norwood Family Eye Care. And I collaborated with Dr. Larita Harris Dorsey. We're all from Mound Bayou, Mississippi. She's from Tri-Site Counseling. So we offer our services as a group. So I was handling the acute and chronic care for the students. Dr. Taylor was handling the dental. Dr. Norwood handles the optometry, which is the eyes and vision. And Dr. Harris handles the mental health. So we started doing that in 2017. We're still going strong. I was at another school district for a brief period, but I ain't gonna talk about that. We'll come back to that. But anyway, we're still in North Bolivar and we're still in West Bolivar. COVID kind of impacted us pretty hard there when that happened, but I'm sure it impacted everyone. But we're doing our best to try to restructure and recoup, from that pandemic. And here we are. Oh, and I started doing medical cannabis, and that's what had me busy tonight.
Okay.
So got certified to certify people for medical cannabis, and it's really picking up. It actually has taken over. I'm doing more of that than primary care now. When I have patients who are debilitated or bed confined, I usually do home visits on them, so that it's not a hardship. And so I just left a couple's house who's in their 80s.
Okay.
Well, anyway.
Okay, yes,
very, very, very sweet people, but they qualified, so I'm doing what I got to do.
Yes, ma'am. All right, so we want to talk about how you carried on our father's legacy, and tell us what spurred you to do to carry on our father's legacy.
Well, Let me think hard and long. I didn't think I was gonna do anything other than this growing up. I just think it was just something that we were expected to do and really intended to do. So of course, when I was in college, my intentions were to and I gotta tell this story. My intentions were to go to med school. So I did several prep programs in the summers, MMMP. Can't remember the name of the one that I did in Chicago, but I did one in Chicago, one at UMC. Yes, you remember that, Dr. Kathryn? Do you remember the name of it? I'm speaking it stuff into existence.
No,
Because I think you ended up doing one of them too. We both
yes,
did the
ma'am.
one at
MedCore
UMC, I
4.
think.
MedCore.
MedCore, that's the name of it. All right, and so I was at Valley my senior year, thinking I'm going to med school next year, and I went to the infirmary and found out I was going to have a baby. And Lord, and did life change. So nonetheless, I still had it in me. I still just wanted to make sure that, I could be able to provide healthcare to especially underserved areas. The underserved areas in Mississippi, we tend to be number 1 and 2 in nearly all the chronic diseases that exist. So I have a passion, just growing up around daddy and mama, I have a passion for helping people who are vulnerable. And I also have a passion for helping people who want to go in healthcare, who find themselves in vulnerable situations. So I made it a mission of mine to make sure that anybody that needed a preceptor that I could precept would be able to come through our doors and get the best training that I could offer as a mentor and a preceptor. I had some awesome preceptors myself, and I knew it was so hard to do that. So I wanted to make that an easy transition for nurse practitioner students. So when I counted up the other day, it was 28 that have come through under my supervision.
28.
28.
28
And now
nurses. Wow.
Yeah, 28 nurses have come through our doors, or when I was at the clinic in Clarksdale.
Yes, ma'am.
To get training or supervision so that they can get their complete certification as nurse practitioners. I had stopped in 19, went through a little period mentally. I said, I ain't doing this no more. But anyway, I was asked this semester to start over. So I am starting back being a nurse practitioner preceptor.
All right.
As soon as the last week in January, we start.
Okay.
So I'm back at it again.
They heard it here first. They heard it here first. You back at it.
So I've accepted 2 students, one for this semester and one for the summer.
Yes, ma'am.
So I saw our daddy do that. Daddy will see one, do one, teach one.
That's right.
And when people would come needing to have a mentor or just, someone to just show them the ropes and show them what he did, that's what we saw as children. We saw mama was the babysitter for some of their children. No, we just saw where he never minded helping people that needed help.
That's right. Yes, ma'am.
And that's a good thing sometimes and a bad thing, but I'm gonna still do it. In spite of some of the situations that I've seen, just learning curves. But at first I said, I'm not gonna do this anymore. Going through this anyway. I'm back on it. Just had to go through some tough times.
Yes, ma'am. I was told you got to take plenty when you deal with our people, so you got to take plenty. You've been taking plenty. You've been taking plenty. All right. So the final thing that we discussed that we were going to talk about this evening was those who are already nurse practitioners and they want to go in and they want to start a business as a nurse practitioner, start their own clinics. What's the first thing they need to do?
All right. So I teach a business management course. So you would think I would know this off the top of my head. I would put everything in writing first. I would not go in without a plan. So first, you want to make sure that you establish a business. And so 3D consulting is excellent in helping you establish a business. You don't want to do it under your own Social Security number. You definitely want to get an LLC or whatever type business you choose that's best for you. You have LLC, you have partnership, you have a sole proprietorship, you have individual LLC, you have group LLC. So you need to make a decision. Do your research on which type will be a best fit for you as a nurse practitioner. Keep in mind that policies and procedures, don't make the mistake that I made. I kind of did them as I went along. I kind of bumped my head a couple of times trying to figure out the best policies and procedures for the facilities. So you want to go ahead and have that in place from the beginning. So after you've established, your EIN, you want to apply for that. You've gotten your LLC with your plan together. Then it's time to research how you want to handle human resources. Because of course, with human resources, you're going to have to make sure you're following labor laws. Get familiar with those. I wouldn't say you have to get an MBA. I got mine after I was inspired by a lady that actually was our speaker. She's passed away now, but when I talked to her after she was our speaker at our penning ceremony as a nurse practitioner, and I was just fascinated. I said, "Well, what made you get that MBA?" And so she told me why. I'm sorry, I got a call me send them to voicemail. She told me why she did it. I said, you know what? I think that's gonna be best for me. So I was able to learn healthcare law. I was able to learn business law. Not saying you have to do that, but it's very helpful to have a business background if you're gonna start a business. Not necessarily required, but it's just good to have. Let me think next of what I had on my list to say that I put in my notes. I can go to those. Hold on.
Okay.
So once you have established your policies and procedures, making sure you get your human resources and things like that in order, you probably want to get credentialed. All right. And so what credentialing means is you're getting affiliated with different insurance companies so you can get reimbursed.
Okay.
All right. And as nurse practitioners, we are usually reimbursed at a less rate than physicians because that's just the way it is. Mm-hmm. Having a physician on site has been a goal for me for several years. It hadn't occurred yet, but it would prevent us from having that discounted rate. After that, you want to choose a population that meets the needs or meets the vision that you have for your organization. Okay. Again, people helped me choose the location that I'm in Shaw because they said they were in need of a provider because they had one for so many years. Okay. And it closed. And when I got there, it had been closed for 5 years. Mm-hmm. So it's been a building process for sure, ups and downs. But just know you want to research what you're getting reimbursed. You want to research what that reimbursement will be for you from certain insurances so that you can kind of know what kind of budget you're going to have. And of course, staffing. You don't want to overstaff from the beginning because overhead is, a part of owning a business and managing a business. Staffing. Wow, I can talk a lot about that. We're going to save that one for another podcast.
Yes, ma'am.
But when you look at the basics, have your vision in mind, what you intend to do. Know that as a primary care provider in a family practice clinic, you're going to have to do more than just primary care. You're going to have to do some ancillary things in order to stay afloat. If you're in an area like Mississippi where we have a high population of Medicaid patients, just know that the reimbursement is much less than what you get from private insurances. So whatever population you go to, that's the population of insurances that you're going to have as well. So do some research on where you're going.
Okay.
The State Department of Health usually has statistics, on different counties and what those populations consist of. So you want to do research on that community. Know the potential that's there. So you can have some kind of estimation of, is there a need? And that's my grandson.
Okay. And so that's how we cut this short.
He doesn't see me in the car.
Oh, goodness.
I'm still
You gonna scare him?
I'm gonna wait till I get out. He going in. He don't know about it.
Okay. Well, if you need to get out.
Oh no, I'm gonna wait till we finish.
Okay, all right.
I was already late.
Okay.
Kathryn, I just don't want
to. Okay.
I'm already 12 minutes late. Anyway.
That's understandable. You're busy. You got things to do.
Well,
all right.
Yes, it's flu and cold season, so.
When I'm looking off, I'm checking our Facebook page to see if anyone has any comments or questions.
I thought you said we was recording this and it wasn't live.
Oh, it is recording and it is live. You see the word live right there at the top.
You said you told me this was gonna be recorded.
You look beautiful.
God, my hair.
You are live. You have been live the whole time.
Who
We
is?
also got a comment from Angela Haywood say, hey, cuzzo.
Oh my God.
Angela said, hey, cuzzo. So yeah, you've been live the whole time, ma'am. Some people are watching through Facebook and some people are looking at just listen to the sound and not actually on the page. Okay, so
Okay.
right. So yes, ma'am, but you are absolutely live right now.
But I do want to get into some of the ancillary services on the next podcast. Speaking on some things that can help increase revenue. What are some other things? We'll come up with some other things.
Okay,
but
yes, ma'am.
Just when you look at the basics, you want to make sure that you're following your passion.
Yes, ma'am.
Yeah, that's the biggest thing.
All right.
If you're in it for money, good luck.
Well,
If you're
in
it because you're passionate about providing adequate health care, I can give a perfect example today. I have a patient with no insurance with several problems. I had to eat it up. If I'm truly here to make a difference in the patient's lives, it can't just be about money. Yeah, gotta keep the lights on, but at the same token, I gotta sleep at night too.
Yeah. So. Yeah, that's a big thing. You gotta sleep at night. You gotta take everything in consideration. But blessings coming. Blessings coming. We know that. You don't work like this, you can get blessings.
It's coming.
You don't work this hard and not get blessings. So blessings coming real soon. All right. Well, I don't want to keep you any longer than you want to be online, and you've given pretty much everything. Is there anything else that you, on top of your head, that you want to share with the viewing public? This is our pilot episode.
Yeah, it's a pilot. It's our pilot.
Yeah, this is our pilot episode. So next time we'll have commercials and everything.
We'll probably look at actually for nurses who haven't gone to nurse practitioner school yet, giving them like some advice on how to apply for nursing school, which area, how to choose which area you want to go into. Of course, I did family, but there are several areas. I have colleagues who are an acute care nurse practitioners.
Pardon me.
Geriatric, psych, mental health. We got several things we can talk about on here. So we'll get to it. The do's and the don'ts. I got some mistakes I can tell y'all I made.
Yes, ma'am.
I might get some juicy mistakes, but I'm gonna pray about those.
Yes. Please do. As we all will. Yes, ma'am.
I might not tell all the juicy mistakes.
I didn't hear what you say. What's that sound?
I said I'm gonna pray about those juicy ones. I hold off on it.
Okay,
we might get some extra views if they know those.
We'll wait till viewership grows and you can get on to your juicy mistakes. If you want to. Yes, ma'am. All right. Well, we can conclude now if you want to. Shout out to all those who are viewing us. Thank you to those who shared. People who viewed us and were sharing, who made comments. Angela, we ain't gonna call her by her nickname, but
her nickname is Tweety.
No, Tweety. We ain't call her Tweety. But Nurse Angela Haywood said, that ain't her name anymore. It's what's her name now? It's not Haywood. What's Angela's name? I'm gonna think of it. But anyway, Angela said, hey, cuzzo. So thank you for those who did view tonight. We appreciate those who shared the podcast with others. It is recorded. It is on our Facebook page and will be on our YouTube channel, and we'll be viewing everywhere. So thank you, Dr. Nora Gough-Davis, Nora Cecilia Gough-Davis, for coming on, coming online and being our pilot for our pilot podcast. And Dr. Davis will be with us later on when her schedule permits, and we'll be interviewing her again. And she's also a consultant.
I have some strong colleagues that have started businesses. We're gonna get Dr. Mary on here.
Yes.
Write her own story. We gotta get her. That was my mentor.
Dr.
If
Mary,
it wasn't for her, I probably wouldn't have precepted another. I probably wouldn't have precepted. I can speak on her 1,000 times. But anyway,
absolutely,
gotta get her on here.
Please do. We thank you. We appreciate it. So we'll get her on, and you and I will interview other people, and then David and Dog will get on, and all kinds of wonderful things. So we'll get this party started real good and real strong. Thank you, Dr. Davis. Dr. Davis. We appreciate you. And we thank everyone for tuning in. And as always, peace and blessings. Bye-bye.